So I'm here full time. I see patients and I also help oversee the volunteers on the clinical side as far as the providers, MAs, nurses, and I'm also the liaison between the universities and all of the clinical rotations that they have for their students for nursing, med schools, PA schools, nurse practitioner schools, and yeah, all of that. Yes, sir. Yes, sir.
How long have you been here, Bonnie?
I've been here almost 2 years.
I know your paid position, but what prompted you, other than money, to take this on? What was it about this clinic that made you say, yeah, I'll do this?
Well, money was not what prompted, because of course, nonprofit world, it's never guaranteed, right? I have always enjoyed taking care of people. I've always enjoyed teaching. I've always enjoyed being a leader of good causes, and I love Pensacola and our community. And it really just spoke to me. I would say really God opened this door, and I just, there were too many very obvious signs and coincidences that came together that I knew God was speaking through all these different people and situations, that I knew that this is exactly where He had called me to be.
Can you share any of those signs?
Oh, sure. I mean, we were at a doctor's office, and I said, have you heard of this Health and Hope place? And the MA that was working that particular day, covering for some other particular person, said, actually, my roommate is the office manager there. And I said, you've got to be kidding me. And then, my husband and I sat and spoke about some of the logistical things, insurance, time, things like that. And he's very, very protective of our family and what we've worked to attain so far. And we just said, what if God's trying to bless us even more than what we actually, because we weren't looking for a new job. We weren't looking for a new opportunity. We were very comfortable where we were. And so then he and I said, well, what if I think this is a place of faith, bigger than where I was serving before. So that was even more fulfilling in that regard too. I love medical missions. That's been my passion too. And I just always had this sense of, when can I go back to medical missions? And I was a little jealous, honestly, of those people that were paid to do medical missions overseas. And I said, man, that would be great to have a job like that, where you get to do what you love. Yeah.
What has been your confirmation? What has been an example of the blessings that you got from doing this job? Can you give me examples of patients or relationships that have touched you, that made you say, yep, this is exactly why I did it?
Oh, so many. Honestly, so many. From the patient side, so many patients are just so very grateful. They expressed that they didn't think anybody else cared, but we do. And I don't have any other friends. I don't have anything else but this clinic. And that's what's helped them take care of themselves, help them take the next step to find that purpose again, As far as the volunteer side, I tell people this all the time, that it's just truly been a blessing to watch the younger pre-med students finding that passion, finding that excitement, and then watching the retired providers, or even the still practicing providers, enjoy pouring into the next generation of medicine, and seeing that interaction where they feel that sense of purpose, and they feel valuable still, right? And they still get to take care of patients too, which they've always loved doing, but then to see why we went into medicine to begin with is this is exactly why we went into medicine to begin with.
What relief is it that you don't have to struggle with some of the things that another clinic might? Can you speak to that? Like, for example, the pharmacy. We know how expensive drugs are. But in a situation here, and of course you have to qualify and all of that, but when it often doesn't cost them anything, and they don't have to worry about haggling over those kinds of things. Speak to it from that perspective, and that your setup here is one in which allows you to focus on care, providing care, rather than this red tape of other stuff.
Right. Well, yeah, coding and insurance, of course, getting, reimbursed for your pet, your care. Our care is invaluable. And I tell people that all the time because it's next to impossible to validate preventing somebody from going to the emergency room, or preventing somebody from harming themselves, or having that relief of providing that Tylenol for free when they now can have no headache, so they can go to work, but they didn't, and then they can pay for their lights or pay for their food, or just having that, knowing that we're providing that sense of relief, even in the smallest way, could be so big for them. We think it's small, but it's so big. It's so big. Something as simple as a pack of Band-Aids that we can provide for somebody. And it's not even just our patients that you have to qualify, because we provide a lot of services that are for the general community even, or their family members. We have some that donate diapers, adult diapers, and the daughter comes faithfully every week to grab a couple packs to help her dad out so he doesn't have to pay for them, and that adds up. That adds up. So, and that's a big draw for some of the providers, to be honest, because a lot of them got out of medicine because they didn't agree with a lot of the ways that they were being incentivized, or that they were being forced to do medicine. They didn't agree with that. And so here it's allowing them to really get back to why they went into medicine to begin with. Yeah.
Can you at all imagine this place not being here?
No. I mean, there's so, this place has grown so big because of the community saw the need. The need is so great. And I mean, the range of people that we touch, that we're able to touch, that we're able to help, is so mind-blowing, in all the different ways too. So I truly believe Pensacola is a better place. Our county's healthier. Our county is, and to think, because we're so big, I mean, we really are in one of the poorest counties in the state. We really do have a lot of folks that fall through the cracks, that are underserved. And I believe our emergency rooms would be a lot busier than they already are. So it is really hard to even imagine that, because so many, I worked in the emergency room, and even 15 years ago, people were using it as their primary care then. And now we're even bigger. We have more people in our county. I mean, it would be very hard to picture what it would look like without organizations, not just like ours. Obviously, there's a lot of others too that help people in all different ways. We've got a really amazing community. We really do love our community, and we want to succeed together.
Yeah. Last question I have is it a hard sell when you, and I don't know how involved you are in terms of donors and interacting with them, maybe not at all, but is it a hard sell to pitch to someone that has money or has time or whatever to get back to this place, or does it sell itself?
Well, I like to think it does. I like to think that we pour a lot of time and energy into ensuring that we are going to be good stewards with whatever time or money are given to us. And I think those numbers speak for themselves. I think our patients speak for themselves. I think our sustainability, our honesty. I think we continue to prove that whatever you're going to give us, we're going to do our very, very best with it, and it's successful. And so we've been very, very blessed and very fortunate to be able to sustain these things year after year and grow. We've not had to turn away patients because of finances, because of not having the staff, because of not, and I think that it just continues to speak for itself. It's awesome.